So your inhalers have changed because recently the national guidelines were updated, where the British Thoracic Society, Asthma Lung UK, NICE, who are the governing body for guidelines, and the Scottish Intercollegiate Society as well, felt that it is better for us to give patients a combined inhaler that puts both your inhaled steroid and a reliever, which is the blue one that as you know it, together to enhance the treatment that you get for asthma, because everybody responds to asthma differently. But this has been found to be the best way and to improve asthma care in the UK, because we are one of the worst for asthma deaths. And one of the main reasons is we want to stop that from happening and to improve the lifestyle that you have and to improve your lung function and to improve your general well being. So, anti inflammatory reliever or reliever therapy, to make it easier, is where you've got the combined inhaler of your low dose inhaled steroid and a longer acting beta agonist or your a longer acting blue, and you only use it when you need it. So, for some people, like I said, they only need it when the pollen count is high, and then when things are calmer, they don't need the inhaler or they don't get symptoms. They only need it. Their symptoms of asthma flare up when they do exercise or when they're unwell, and then the rest of the time they're very well. And that is when they only need to use it. So you've still got one puff up to 8 puffs of your inhaled steroid that you can use as a reliever. But again, just to emphasize, if your symptoms flare up and you've changed your doses to a maintenance and reliever, then you need to be seen if things are flaring up and escalating. But otherwise, if your symptoms are only based on what you do or what the weather is like, then you can use your inhaler just for the relief. And then when symptoms are better, you can stop and still carry it around with you. So never leave your inhaler at home. So, for example, if you exercise once or twice a week and you only need one puff up to two before or after exercise, that's fine. If you're exercising 3 or more times a week, it might be worth you, and you get symptoms every time you exercise, then it might be worth you changing your doses to a maintenance and a reliever. If your symptoms only flare up in when there's high pollen, then that's exactly what you do: one puff to relieve the symptoms or one as many times as you need. But as long as you're not doing eight or more than eight, at that point, then you need to change to a maintenance and reliever. If your symptoms only flare up when you're unwell because of a viral infection or a bacterial chest infection, then again you use the inhaler when you feel unwell and when your symptoms are better. You carry it around with you as you normally would with your blue inhaler. You might be feeling worried again about not being used to carrying your blue inhaler, but in actual fact, if you think about it, what is the point of carrying something that could end up doing more harm than good? So again, it will take time. We completely understand that it's something that it's a cycle that we need to break, but we will just encourage you to keep persisting with the new change, and eventually it will get better. So in summary, inhalers have changed, or I would say let's call it the treatment of asthma and management of asthma has changed because the national guidelines have been updated and improved. Because we want to improve and reduce the risk of you having an exacerbation. Because we also want to make it more flexible for you, that instead of having two separate inhalers where you're trying to figure out which one am I meant to be using, you now have one inhaler which does both, or whichever way you use it. Like I said, you're either using it as a reliever or you're using the same inhaler as a maintenance as well. And ultimately, it's to make sure that you're much better, you're more improved. Your asthma symptoms are not causing you to have a less quality lifestyle, but actually to make things much better in the long run.